Hey there, Raelan here. So we have a bit of a unique recovery story interview here today. It is with a woman named Aristea Mastars. She is over in Lausanne, Switzerland, and not only has she had her own quite long health journey for many years, struggling with a variety of symptoms and being told that it was depression. For a while, she was told that it was bipolar disorder because of the extreme fluctuations in the energy that she would have, and eventually came to a diagnosis of ME. But she's also a cancer immunology researcher, and she's used her experience and expertise in research to dive into some ME CFS research. And she's come across some interesting theories and has made some progress and has been testing on herself and has made a lot of progress with her own health. So she's looking at things like how a chronically activated immune system can impact and cause a lot of the symptoms that we're seeing, and how this impacts neurotransmitter function and so forth. And she's even been in touch with people such as Dr. Ronald Davis, talking about the research that he's doing. And she knows a lot about things like the Abilify medication trials that are happening. So if you're the type of person who really enjoys getting into the science of it, and if you're curious about what some of the research is that's happening around ME/CFS, this is going to be the interview for you. So let's dive right in. Hey, Aristea, I'm so happy to have you chatting with me today. Thank you so much for doing this.
You're welcome. You're welcome.
So yeah, why don't we just jump right in? We're here obviously to talk about your story and things you've learned along the road. So can you tell us a bit about about your health journey? How did this start, and what did life look like before that, and so forth?
So for me, it started well. I think it's a common start. EBV mononucleosis in 2012. I was in the midst of my bioengineering studies, and so it hit me pretty much in the middle of exam session. Basically, I failed epically my third year exams, my bachelor exams, and I was just so exhausted I could not. Took me 2 years to and a medical certificate. So when I repeated the exams, it was not happening. So medical certificate from the doctor, and pushed them off another year. Endless fatigue. I didn't even know. We did not had no idea. The doctor said it was depression, basically, what we all hear at some point. And somehow, I still don't know how, but I guess I sort of went into remission without knowing. 2 years later, when I repeated the exams, I managed no issues. So I have my bachelor, but that fatigue basically lingered, and there was no way I couldn't see myself doing a master's and all that. So I basically took on a low energy job, which was a lab technician in a research lab, and basically learned on the spot the job of a technician.
Wow.
And took it from there. Learned a lot, and then I got a publication also in high level cancer cell publication on brain cancer, basically glioblastoma. And then I just went into that direction came out of it. So I did come out of it, and I was fine. And I have lots of fun hobbies and stuff. So I'm into sports, so I was skydiving, telemark skiing, and all of this. And I went on for a new job actually come 2016 in immunopharmacology of cancer. And turns out things went downhill after that. So I had a wonderful first year, and then clearly relapsed. And turns out I actually figured out why. And it's part of my entire research and all. It took me a long time to figure it out. But yeah, oblivious to the existence of ME/CFS. So the whole time, it was just assumed I'm depressed.
Wow. This is a
And
lot.
so society makes you think that. Go through therapy. So I'm at the work, and things are so bad, and I can't. I get all the neurocognitive symptoms. I can't do my job properly. I'm fatigued. And here we go back to like the sports. So sports was a way out, And this is a key part of the research as well, figuring out why sports was a solution for me. Because I bike to work every day. Mm-hmm. And the days that I biked to work, I was fine. The days I didn't bike to work was hell.
Really?
Yeah, so this is part of how I figured out what's going on. And that's when I started to suspect neurotransmitters. And at the beginning it was serotonin. That's the sport, that's the happy hormone, blah, blah, blah. And I went further on, and this is, I don't know how detailed you want me to go into the research. It's a long story.
Well, that's part of why I wanted to talk to you today, because I was excited because we connected in my Facebook group, and you've shared some really great stuff. I was reading some of your posts. I'm like, wow, this woman has learned a lot. She's been through a lot. And then I started Facebook stalking you a little bit and looking at your profile, and as we do, I'm like, wow, she looks incredible. And I saw all these insane sport pictures and just really adventurous life. So it sounds you became unwell when you were in university, and it sounds like you had a really rough couple of years, and then it led up.
It's sort of remission. I can't tell you why, except maybe the therapy. I mean, there was I was seeing a psychiatrist back then, and he had put me on different medications, and one key medication that came up in the second relapse was this is part of the key of figuring it out. And this is not at all an incentive to take this drug. It is nasty as no drugs. Okay, everything I've done in the end is to get rid of this drug.
Okay. This is not an ad for the drug. We are not promoting it.
No. Do not take this. It is very nasty. It's a key in figuring out where the problem is. Okay, because I reacted well per se to this drug. It was venlafaxine. It's an SNRI. So SNRIs, what are they? Serotonin and noradrenaline reuptake inhibitors. Okay. So I had already been on an SSRI, which is just serotonin. I don't know how familiar you are with these, but they're antidepressants. And I never reacted really to the SSRI, so the one that's strictly serotonin. So I was making serotonin like crazy with biking, so useless. But one of my massive relapses, I was stuck in bed for 2 months. So very far gone, paralyzed, literally paralyzed. You can't move it. It's just a weight. It weighted down, just lead from everywhere. And I was desperate back then. First month, I'd forced myself still to work. So this was following a sort of cold. Turns out I suspect it was EBV that came back. Okay. Long story short. So there was a reason for it to come back. And from there I just crashed miserably. So inflammation. So in there was already the key. Okay, we're dealing with something with inflammation. Okay, this was a recurrence. Every time I would have this sort of recurrence of EBV, an inflammation in my body, baff, I would just crash miserably. And the cognitive symptoms on sort of anxiety, depression that comes on, induced, I work in immunology of cancer. So my lab was already doing all of this. I already have an idea. So the fact that suspecting inflammation that came on very early. But yeah, back to the antidepressant, the SNRI, is basically I snapped out of this long-term crash. After 2 months, I took this, somehow forced myself to the shrinks. And he puts me not only on, put this chronologically. First, he puts me on lithium. So the doctor's actually suspecting bipolarity because I'm switching from high activity, my level of activity, it's not
Right.
high activity, it's my baseline,
Right.
to this very depressive, paralyzed state. So he's suspecting bipolarity. It puts me first on lithium. Nah, nothing really much. Nothing happened. 1 week later, it puts me on venlafaxine. And within an hour, no, this is not a joke. Within an hour, I get up to go to, so I take it in the morning, 7 a.m., whatever, 8. And I go to the bathroom an hour later and I was like, oh my God, I can move. The weight is gone. Wow. It's like, what? And I was like, yeah, that's too good to be true. So you go back to bed. And, well, as patients probably know, it's like, okay, you do whatever you can. I was still able to listen and sort of follow episodes, series and stuff during those 2 months. It was sort of my way of getting out of that induced anxiety. And an hour later, so after like saying, okay, it's too good to be true, an hour later, I was like, I'm bored. I just suddenly get up and clean the apartment because it's been in ruins for 2 years. No joke. It's in terrible shape. And I finally, the long to-do list, it was like racking around along in your brain. You just get it done. Okay?
So
and then
what
the doctor,
was it? Sorry, I feel like I missed something here. What was it that allowed you to finally... Because you were just able...
venlafaxine.
Oh, it was that. And with that, you were able to get up and suddenly tackle things that for 2 years had been building up. And wow.
And it was crazy. And then obviously they tell you, okay, it's placebo effect, it's too good to be true. It was like, you don't snap out of it. What I didn't know was a crash back then. You don't just snap out of it just like that. There's a long story in between. A year later, I start now, well, 6 months later, I start crashing massively again. And this time, like yo-yo. Up and down, up and down, up and down. I had minor crashes before, but now really it's an onset of a cold that comes back again, you know? So this is December 2019. Okay? December 2019, I started crashing. This is 6 months that I've been on these new drugs. And this is now hell. I'm on a roller coaster and I can't get off. You know, the tired but wired, and at the same time these crashes I couldn't work. And it's like a really miserable, not just paralyzed. I can't freaking move. I can't get up. My body is tired, exhausted. Not even exhausted, just paralyzed. So researching mind goes on, and at that point I'm researching inflammation and depression, the link in between. I still have never heard of CFS. Still haven't heard it. And I'm racking up second opinions, whatever. Well, anyways, I still have my main psychiatrist, and he just ups the doses. So he goes up. Things get worse. And it's a very long, detailed story. We'll skip to the interesting parts. Is that I suspect lithium at some point because I'm dehydrated, and my dehydration is causing crashes. And so, I just start. So I'm playing around with these drugs a bit under the supervision of my doctor, obviously. But clearly I start to notice he has no idea what he's doing. I think that's a story that most of us have to deal with. So I'm still researching depression, inflammation, and friends know about this. And it's like even my boss knew about this because she's a pharmacologist. So I was like, she's like, yeah, what are the interactions between the drugs? Where can I find information, on this? And a random friend, puts me on the trail of post-viral infection or syndrome, chronic fatigue. I was like, okay. It was like this now post-viral. This was very interesting. It was like because I had detailed symptoms of I would have something related to inflammation, a cold, my period, or too much sports that would also induce inflammation in the muscles or whatever. these paralyzing crashes afterwards where I can't work. It's excruciating to get up to go to work. So doctor has no idea what's going on, and I researched profusely and finally discover ME/CFS. Oh, wow, not recognized in my country. Okay, doctor's oblivious to this.
Oh,
okay.
wow.
And so you're trying to actually find information in your own country. Where's this going? So you come across a YouTube video of a chronic fatigue syndrome in French. And so you've noticed this doctor specialist in your area is like, oh, so they are aware of it. I go to the local hospital, try to get in touch with this professor. He knows of this. And they totally screwed me over, to put it lightly. I had put them in contact with my previous training, like saying, okay, this guy has no idea what it is. He never heard of chronic fatigue syndrome, so how does he want him to be able to judge the situation? And they still stick me in bipolar disorder. Why? Because I reacted to venlafaxine. When I was like, well, hypersensitivity to medication, ME/CFS, guys. But no, it's elimination. They do the old version. I don't know how doctors still diagnose this, but yeah, they do the whole get rid of, eliminate all the other possibilities before diagnosing. So anyways, I realized these doctors have no idea what they're talking about. Long story short, I'm like, okay, well, if they don't know, I'm going to go figure it out myself. I'm not going to I was never one to take no for an answer, or we don't know for an answer. I'm a freaking researcher. I'm going to go figure this out myself. So, long research, and there was a naturopath that came into this story, and this guy really has the holistic approach in doing extra blood tests that no hospital would do. Mm-hmm. And now you have doctors that have been telling it's too much stress, too much, you're not eating right, not enough sports. I mean, come on, not enough sports, seriously, etc. And so as a natural, we eliminate hormones and everything. We nutrition, hormones, and everything, and we isolate neurotransmitters and lymphocytes. Yeah, I don't know. I'm sorry. I hope I'm still a little bit in the current chronology, but basically, hospital tells me, okay, you're bipolar. Go get electroconvulsive therapy. And, they told me to go get myself ECT. It's like, okay, guys, you really have no idea what you're doing. And, so then I go and get myself a noob psychiatrist, a Harvard-trained cardiovascular surgeon turned psychiatrist. I get my own McDreamy. I find myself my own Dr. McDreamy works in my city. And he, within 3 weeks, it's clear for him this is not bipolar disorder. So that's when the whole online story. So once I had his confirmation, I knew my self-diagnosis was right the whole time, but I didn't dare go state it without confirmation. So I get this confirmation come December 2020, and 1 week later, I was online sharing my entire story. Because what I had just gone through with the hospital, this was out of the question that this happens again. And we need awareness. Switzerland is completely oblivious to the existence of this disease, at least in my area. So I share everything. Wow. To the point that I actually go and share online my own blood tests. So I come up with neurotransmitter tests, okay, which basically confirm, if you go look at what the neurotransmitters are doing, what they're responsible of, and my symptoms, they fit perfectly. Okay, so I have low dopamine, and I have high, its degraded metabolite is too high. So why do I give you this information? It's because it's key into the whole process of how I figured it out. I start networking. I use LinkedIn as well, not just Facebook. So LinkedIn has all my bioengineering classmates, colleagues, people that are high level in the research field and would be curious minds. They got curious minds. So I'm posting a very sort of diplomatic version on LinkedIn, and then Facebook, I just give it all. It's like throwing it out.
Give it to you straight.
It's my profile. I'll do whatever I want. And I post these results. And then there was also, like, according to the hospital, I'm perfectly in perfect health. I mean, this is the problem that we are facing, that every patient is facing. We are claimed to be in perfect health. So when my naturopath suggests to also not just run the neurotransmitter test, but to test the lymphocytes, which are the immune cells. I mean, I'm working on this. This is a FACS, F-A-C-S. It's a FACS analysis that my lab does every day on mice. You know, we do these tests on mice, and now the naturopath wants to do it. I'm just like, yeah, go for it. I'll pay for it. No issues. It's like, no problem. And then results come in, and you see I am severely chronically ill. I do not have the immune cells that control the immune system and dial it down. There is no brake on my immune system. So my immune system is going on like crazy. It's chronically active. So I figured that one out. Then I have the neurotransmitters. And like I said, I was already researching long before knowing ME/CFS. Was already looking into inflammation and inflammation and depression. So I'd already come across this beautiful medical book from Oxford Medicine. So the title is immunopsychiatry. So you're like, no, this is not ME/CFS related, but yes, it is. It's just I took the chapter of immunoneuropharmacology, just chapter 2. And it explains how the cytokines that are produced during inflammation, so these hormones that are produced during inflammation, are able to cross what we call the blood-brain barrier. So this is the barrier between the blood and the brain cells, okay? And these molecules can pass through. And what do? Once they so the entire nervous system, they can go through and cause mayhem, and they can degrade your neurotransmitters. Oh, wow, dopamine. I'm low on dopamine. And what does dopamine do? It controls body movement. It controls motivation. Oh, that's interesting. Well, that's just, I'm paralyzed in bed. Maybe that's something interesting to look at, you know? So I basically connect a few dots, quite a few. And what's very interesting is that with my online, so this, I figured this out, I'm researching, I'm not alone in this. I have one very important person in my life, the former professor who helped me already during my failed exams in 2012. He supported me. And now I contact him again because he lives for this kind of medical mystery. So I'm brainstorming with him. I'm brainstorming with a neuroscience PhD student. And we're just bouncing ideas around, and very soon the conclusion is, okay, this we're dealing with degradation of key neurotransmitters because of systemic inflammation. Yeah. So with this info, I'm not finding anything in my research in the ME/CFS groups, Facebook or whatever. I'm not finding these in key research articles. I'm like, where is this? Am I completely out of whack, or is there some truth to this and nobody's figured it out yet? So I go networking like crazy. So I take my LinkedIn account. I have 120 contacts, nothing, dead. I mean, I'm not using it. Take that one, I request contacts, and it's not like Facebook. You can't request just anybody. It's like you have to be it has to be a close contact, a friend of a contact of a contact. You know, that's how it works. And then you can contact these people. So I'm going big, one by one, over a month. And then I hear of Professor Ronald Davis's book. his brand new book that came out 6th of January. Don't know if have you read over this one?
I don't think so. No.
The Puzzle Solver, a scientist's desperate quest to cure his son. So it's brand new, and so but Ronald Davis, I'm sure you've heard of him.
I have, yes. I wasn't aware he had a book out, but I'm definitely aware of him.
So I'm in the research field. I deal with professors. For me, it's very clear. This guy's I can send him all the emails I want. He's never going to answer me. I'm just going to be in the midst of their spam. Yeah. These guys are drowning in emails. Yeah. So I was like, I'm low on energy. We're not straight to the point. We do this a different way. And so I contact the author. So I get her through LinkedIn. Tracy White. So I get in contact with her, and I send her a file of my research, and I was like, okay, you have the ability to judge what I have here. If you see the importance in it, which I know you will, basically, could you please send this to, if you see the importance, would you bother the professor about it? If you see there's a point to it. So she sends it to him. In less than 24 hours, I have a congratulations. Nice work is the title of his email.
Wow.
So Professor Ronald Davis sends me an email like,
wow.
With the time difference, it's like 4:30 a.m. And I was like, I need to answer this guy. He sent me an email. And so he congratulates me for the research I did with basically no resources, and I made conclusions that basically barely anybody has. Mm-hmm. I mean, obviously in the field, they are looking at what I'm looking at, especially with the Abilify trial that's going on in the moment. Mm-hmm. So which is on dopamine, that works on dopamine. Abilify at antipsychotic levels, so 10 milligrams or up, will decrease dopamine. But if you go into low dose Abilify, so this is an article, I'm not making this up. This is an Abilify article that has shown retrospective. So they have patients, they look at which ones have improved and see the commonalities, and Abilify pops out. So they start researching this, they start looking into why, and indeed it's working on dopamine. So at low dose Abilify, it will up dopamine levels. And you have 80% of patients who are responding to this positively. So I know I'm onto the right track. So let's continue. And so this obviously confirms basically all the self-doubts I had, because in the middle of this, I'm like, okay, am I making the right conclusions? Why has nobody else made the right conclusions? Yeah. And I continue, and at some point, the naturopath of mine comes with a suggestion for upping dopamine levels, but upstream of what Abilify does. And research tells me also that there's two parts. So there's the inflammation, the initial inflammation that comes from, that's still trying to figure out that one, but from a cold, from too much energy or to exercise or whatever. This basic primary inflammation that comes on in our bodies would then degrade dopamine. And low levels of dopamine would then start a secondary inflammation. Okay? So no dopamine would control systemic inflammation. So no dopamine, there's no control. So you just got full-blown inflammation, which is just a vicious circle of a degradation of ketone neurotransmitters. I've gone so far to suspect, I do not know this, but I suspect that there's degradation of GABA neurotransmitter, which would perfectly explain the tired but wiredness. But this is just a hypothesis. These are ideas that well, there are other researchers, come to me, brainstorm the whole thing. Another key factor was a brainstorming group that picked me up. So just like you saw me in your group, I had someone else from other groups who contacted me, and basically I'm brainstorming like crazy with them now. And getting further and further, because now it's not just dopamine that we're suspecting, it's also acetylcholine, which is also well known. And acetylcholine is responsible for muscles. So the neuromuscular pathway is acetylcholine. So the fact that we can't move and that we're so fatigued would be explained by low acetylcholine. There's nothing connecting our neurons to nothing relaying the information. You can think all you want up here. If it's not reaching your muscles as it should, you're not going to move. So you have these, and then if you go look, low acetylcholine, you have like all the symptoms of CFS that show up, So it's these two key neurotransmitters that I've come to start targeting on my own with help of my naturopath as well. And they're showing they're showing key effect, and it's what's keeping the one targeting acetylcholine is what is keeping me out of a crash at moment and enabling me to have this discussion with you, or a monologue actually. But at least I didn't crash, otherwise I would have had to cancel, So it's been now 2 crashes, and so I talked also little details. So I talked to you about dopamine, noradrenaline at first, okay? And now I'm talking about dopamine. It's like, what's the link? Basically, noradrenaline is the substrate, is downstream of dopamine. And if you don't have any dopamine, you don't have any noradrenaline. Okay, that's why this pathway, this signaling pathway, I suspected it from this beginning. Noradrenaline mainly, but also dopamine. And when my tests came back, it was clearly, okay, low dopamine. How can I have normal noradrenaline levels as well? And all of this, it's a lot of science here. Okay. All that I'm saying, I do have scientific articles that I can share. So I'm not just randomly giving this stuff. I really important that everything that I'm stating is actually based on just connecting dots from different articles.
So now, I'm curious, sorry to interrupt, but this is fascinating that you've done all this research. This is very impressive. And I'm just so grateful that there are people like you out there who are research brained and science and just have this way of thinking, because I am not wired in the same way as you. So it's really incredible what you've pulled together. So what at this point in your life, what has that meant for you in terms of just your own health? Like, what have you seen in yourself with all of this?
Okay, what's clear, the message CFS 101, what I've started to call it, every patient is different. And my research, the research I sent to at the beginning to Professor Ronald Davis, explains this. This was my hypothesis of why it explains the two main hallmarks of ME/CFS. Is why is there a delay? Why are we crashing 36 to 48 hours after the fact, after the cause, the trigger? Okay, there's that one. So the cytokines that I mentioned, they're flooding your brain, they're flooding your system, come inflammation, and they are degrading your neurotransmitters. But that takes time. Okay, so you need a certain time to deplete your neurotransmitters level, and you will be using them as well. So you have dopamine until you don't. And I've noticed on myself that every cause has a different delay and a different kind of crash. So I have different variations of the same crash. And I was really noting this in detail, the onset, and whatever memory would still work up here. Because you also I was doing this research in between crashes. I was miserable as wow. So it took time. It was way longer than I usually would, but it happened. Anyways, it worked out. I figured it out. So that was hallmark number 1, is why the delay. And then hallmark number 2 is, why are there so many different symptoms among the patient population? I mean, it's huge, the variations. But this is very simply explained. The inflammation, the number of cytokines we produce will differ in every single person. Okay, and these cytokines have to cross this blood-brain barrier, okay? And normally you would block this. I mean, if a healthy person has a strong blood-brain barrier, and we're talking about people that are already a bit sick before and would have weakened blood-brain barriers, okay? And then these barriers would not be weakened at the same place, okay? So let's say there's a weakening in the area controlling hormones for body temperature. And these are just theories, okay? It's not quite right what I'm saying. I'm just simplifying. But basically, there would be a difference in permeability of this barrier in the brain and the entire nervous system. And this would differ between every patient based on environmental factors, based on medical history, meds that have been taken in the previous. I mean, there's so many different factors. This would explain how how we have so many different variations. And then we label them. We try to fit people into fibromyalgia because they have pain. We try to fit people into, I'm suspecting Meniere's disease, for instance, to be just another variation of ME/CFS. And all these different names that we're giving them. And basically the cause is all the same, an overactive immune system, which is causing degradation of neurotransmitters in key areas. So this is what I'm doing at the moment on my own, one-on-one. I mean, Professor Ronald Davis is aware of this. I send him regular emails on what I'm doing, and he will take it and put it in large scale. I mean, this is I'm not a doctor. It is out of I can't do this on a large scale. I don't have access, and at the same time, I have started my own little nonprofit. Oh, we're reaching the end here, so I'll end with that. I am actively searching for patients who are curious, and I'm not giving medical advice per se. I am giving scientific information, sources of information, explaining as best as I can where the problem is. Okay, this symptom is a sign of this deficiency. The way to hit this deficiency is to up the levels using this, and to basically give the patient, when no doctor gives them, give the patient the information so that they can make their own decisions.
It's fascinating to hear about some of the research that's happening and, some of the discoveries that are being made. And I know there are a lot of people that really like to dive into the science, which is not something that I've talked about.
Yeah, so I'm looking
channel.
for more people, but basically I'm a bit on my own here, and I've found a few people who are always looking for more. I mean, I'm not saying everything I'm saying here is right. Yeah. No, please give it to me straight. Just let's brainstorm it. Yeah. The key symptoms that changed basically, just with dopamine. I don't no longer have frozen hands and feet. I am no longer craving carbs as an alternative energy source. My sleep, oh my God, the refreshing sleep, that was amazing. I was up like that for like 10 years, and then 5 days in a row, 5 nights in a row, it's like, oh my God. Oh, no. I was and then no more tired and wired.
Oh, it's really interesting.
There's a lot. I could go on and on.
Yeah, I suspect we could do this all day. There's just a ton of research, and you're just a wealth of knowledge on this. Aristea, if people do want to reach you, if they want to get involved, if they want to learn more, what's the best way they can do that?
So I started my own Facebook page, Facebook group. So just go on, basically simple, ME/CFS Consulting. Nobody's doing it, so I'm doing it now. So I have that on both Facebook, the page, and LinkedIn.
Thank you. I know we could go on all day, but I also know people have limited, energy stores, yourself
I can't
included,
imagine. The amount of info I just
it's
put
always
out there.
Yeah. People are like, okay, that's enough. My head is full. That's okay. That's enough for today. And then once I've digested that, maybe I can take some more.
So that's what I'm targeting. I'm targeting the patients who still are not suffering from too much brain fog and who can still figure their own research what I'm saying themselves to a certain extent.
Thank you for doing this. Thank you for sharing a bit of your story, for all the research that you do. I really appreciate it.
CFS Consulting, free of charge.
Excellent. And then thank you to everyone who's watching. You can put questions, of course, in the comments below, and we'd be happy to answer them there. So yeah, thank you again, Aristea. Thank you everyone who's watching. And
there's another side to this, and there's a lot of energy to gain. I didn't even know this existed. So there is hope.
There is hope. Whatever. There absolutely is. All right.
We just got to do it ourselves.
Yeah, a lot of it seems. All right. Okay. Thank you. That's it for today.
Bye-bye.
See you in the next video. Bye.